Hey, afternoon, Bay. Dr. J coming at you with a little exercise tidbit of the day. Today we're going to talk about coupled motion as it relates to the lumbar spine. With the lumbar spine, we want a normal, what's known as lordosis, or curve in the lumbar spine. Right? With coupled motion, the statement implies there are two motions that have to work together. They're coupled together. With the lumbar spine, those two motions are lateral flexion, right, going side to side, and rotation in the lumbar. They have to work together. Here's the trick though. With good posture, meaning a good lordosis, when we bend to the left, our vertebrae, our lumbar spine, has to rotate to the right. Say that again. Left lateral flexion, bending to the left, with good lordosis in the lumbar spine, invokes right rotation of the lumbar. Lean to the left, lumbar rotates to the right. But what happens if we're slouching? What happens if our normal good curve just trying it all the way up there. If our normal curve tends to look a little bit more like that kind of posture, right? So instead of that, now we're like that. When that happens, now that same left lateral flexion is going to cause my lumbar spine to rotate toward the left, right? And that's not the right motion. That's not the right direction, which means all the muscles and joints involved in that, all the neural connections and motor patterns that are associated with that are learning something incorrectly. They are learning to literally opposite their intention, right? Now, we need control to be able to get into those range of motions if load demands it, which means some practice is involved, but the number one postural mechanism for any kind of disc herniation or disc injury is loaded extension and rotation from a flexed position. Demonstration always works easier. So, this is a flexed and rotated position, my body. If I'm picking something up, I am extending from a flexed and I'm rotating from that flexed. That puts a lot of pressure on the anterior portion of the disc. It puts a lot of pressure pushing that disc toward the posterior, toward the whole neural network of the spinal cord. Right? And that's where a lot of the bulges and ruptures happen. Good normal curve, all of those discs are lined up better, vertically lined up and stacked better. And a movement now of trying to pick something up allows all the structures attached there to actually help pull into the proper motion. All right, exercise of the day. This is why posture matters. All right? Practice with good posture, you get good patterns. Check later.